afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Thursday, May 6, 2021. Well, it's a big week, and this time of year is a big week in my household because 2 days ago was my wife's birthday. May the 4th be with you. Is a big deal in our house as we like Star Wars and the rest of them, but it's also her birthday, and also with Mother's Day coming up this week. So it's been a big week in our house as we celebrate all week, and we'll celebrate this weekend. But in the health system, and I do a lot of special days, and Tuesday, one of our meetings was National Renewal Day, and as the spring comes on, Tuesday was the day of renewal and spring forward and moving forward. And that's a lot of things going on in the health system right now in the community. We're working with several leaders in the community on our community needs health assessment right now. And we've got work going on that. I was in Austin yesterday with the legislation in full force. It took a few weeks to get it going, but when it happened, it went full force. And there's a lot of things going on that are affecting not only the rural communities of Texas, but also from a healthcare perspective, affecting the rural communities. So we were down in Austin yesterday and spent some time in Round Rock working with some players to ensure that we're protecting, being the last independent Northeast Texas. It's critical that we play a vital role with the other rural hospitals in Texas. So we're excited to be there yesterday and do that. From a health system perspective, we've gone to monthly, the first Thursday of each month of having these updates. So a few things that are going on, just wanted to talk about is the vaccines. And we are behind our vaccines for Northeast Texas, and we're following it closely and watch the numbers. We're participating in several different groups and cohorts to try and work to increase our vaccine rate in the Northeast Texas. The one thing we have done, we talked about it a few weeks ago, but you'll hear from here out forward, is Vaccinate East Texas. And we have opened up a clinic in the hospital Monday through Thursday from 7:30 to 1:30. If you go to our website, and I'll click on that in a minute, show you, you can register online and get your appointment for these days. We are finishing up the Pfizer second doses this week. Probably will finish up Pfizer in the next few days, and we'll be back to Moderna, first and second doses of Moderna. We'll continue to work with the state to keep our allocation up and make sure we're continuing to receive vaccines on a weekly basis. But we have this going on. Angela, my wife, is now working down there with the team and having a good time getting people vaccinated and watching different people. She's blown away about how excited people are about getting their vaccines. So please come join us, 7:30 to 1:30, Monday through Thursday. No appointment necessary. The appointment does help. Let them know you're coming so they can make sure it's thought out and they have plenty for you. So I would encourage you to take advantage of that and come join us and get your vaccine and do your part. There's our website. If you look at TitusRegional.com, the vaccine information at the top, you click on that and you go straight to where you can register and save you time so when they know you're coming. So it's a good thing to have on there. From a numbers perspective, haven't seen over the last few weeks, a huge increase. We stayed flat. Earlier this week, we saw an increase that went up to about 120. We're a little bit concerned. It's dropped in the last few days and gone down. Our health system is consistent with these numbers as well. We've seen 2 or 3. We saw 1 for a while, then 2, and then we were up to 5 late last week, and then on the weekend hit 6. But now back to 2 and 3, and those numbers are getting back down. So we're watching it closely. I did read this morning that hitting from a national standpoint, the lowest point in a long time. So we're watching it. We feel we're still on the right path, but we'll still continue to wear our masks, vaccinate, social distance, and do our part. But we'll continue to follow those numbers. From a health system perspective, when we move on, some things are going. Growing up, this was one of my favorite sitcoms, and Wheezy and George, the Jeffersons, and the song always comes to my head of Moving On Up. And the start of that show. And we've got a few things going on in the health system right now that's going to take us to the next level. We've got adding tomography over in the breast center and the women's health center across the street. It was a big win this spring, but we're in the process right now. If you've come to the hospital, you see a couple roads blocked, that we have moved out over the last few weeks. Our CT, that is right there next to emergency room. And then you can see it coming in, coming out. So a large piece of equipment. So we're in the process of replacing that CT. We have a truck that's a mobile unit that was here for 6 weeks. That it's just kind of a stopgap because from a CT perspective, the one that's in the emergency room down there is for when you come into the system and you have to get that CT quick. So it's 24 hours a day, 7 days a week. We depend on that piece of machine. It's a life-saving piece of equipment. So we do have a truck right now and a mobile unit doing it. Construction should finish today or tomorrow. We're excited about that, and the piece of equipment will be here Monday. We are purchasing a state-of-the-art, state-of-the-science piece of equipment. It'll be a lot smaller than this. The footprint will be smaller, it'll be a lot quicker, which is the most important thing. Getting those reads and those views to your doctors quicker to make a decision. So we are moving on up, and we'll continue to upgrade our imaging and some more things that are coming down the road as well. But we are excited that this is another life-saving addition to our health system that we believe will help Northeast Texas. You know, today starts a few of great things that are happening over the next few weeks. And want to start today with thank you to all our nurses. Our nurses that work for the health system today, our nurses who have worked for the health system in the past, our nurses who've retired and still volunteer here and do things here as well, but also nurses throughout Texas and throughout the world. But really here at Titus, just want to say thank you to our nurses. This is a big week. May 6th through May 12th is when we recognize National Nurse Week. But just want to say thank you from the bottom of my heart. My job is to support our nurses. My job is to make sure that our nurses have what they need to provide health care on the front line in emergency situation, in preventative and wellness situations as well. So thank you to all our nurses. Thank you for what you go through. Thank you for the career that you've chosen. You do save lives, and you are saving lives in our community. Next week is part 2 of celebration of kind of 3 big things that happen over the next few weeks. It is Hospital Week, and we'll start celebrating that on Monday, and we have some things planned throughout the week to say thank you to all of our team members here at Titus across the board. So our theme this year, as you can see to my right, Excellence Together. Bobby D and the team did a great job on our logo this year and our brand on that one. And really over the last year, in the last 14, 16 months, we've made an impact because we've stayed together and we've done things together. So we're going to continue that theme into Hospital Week next week, and we've got some few things planned for our team to really cement that excellence together and get to know each other a little better. And we have 800 plus employees and providers in the health system. You know, it's always an opportunity to make sure you're going to other departments and working together. But we're going to celebrate that next week. So my ask of you from a community, first of all, we appreciate your support. We appreciate our partnership with the city and the county and state officials, and we look forward for them participating that is owned by Titus, but also our relationships with the ambulance services in the counties around us that provide not only for Titus County and bring things here from other counties, but work with us when we need as well. But thank you to all our EMS and ambulance personnel. We appreciate what you do for the lives that you save on a daily basis. And then finally, I want to end today, got to end May with just Mother's Day. And just want to say happy Mother's Day to all our mothers out there, to my mother, to my wife, my niece who became a mother yesterday. Happy first Mother's Day to her as well. To my mother who became a great-grandmother yesterday as well. I had to throw that in. But I want to say happy Mother's Day to all the team members at Titus, all of our doctors who work here are mothers, and then all of you who watch this show and support our health system and support us on a daily basis. Just want to wish you a happy Mother's Day and just enjoy this weekend. And we truly appreciate our mothers make a lot of the decisions in the healthcare process. So we appreciate what you've done, and we appreciate you. And this Sunday is about you. So happy Mother's Day, and wish you the best. So on the behalf of everybody at Titus, I want to thank you for everything you've done. We're excited. Look forward to we come together next month and we talk about some things that are going to happen. And then as we start getting ready for summer, we're excited about a few more things. So thank you for your support. God bless.